Cedars-Sinai is one of the largest deliverers of healthcare on the West Coast. We run a large primary care network, and at the same time, we also deliver the most complex, complicated quaternary and tertiary services, programs which really require the highest medical skill and talents in the nation.
Cedars-Sinai has gone through a tremendous transformation. We went from a high-quality, community-based hospital to an academic powerhouse.
One of the great advantages we have, of course, is living in one of the most wonderful and diverse cities in the country, and it doesn't hurt that the climate isn't too bad either. We are blessed by a great environment, intellectually as well as personally. We get nearly 200 applicants for every one of our residency slots, and that allows us to have the very brightest trainees who make our chances for continuing to push things forward and innovate even greater.
I think what's been impressed me the most during my first 2 years here at Cedars-Sinai is how much the program and the faculty care about you. The faculty operate on a first-name basis. They're very invested in not only how we're progressing as a radiation oncologist, but also how we're doing outside of the clinic.
We have tremendous interactions with other specialties at tumor boards, and while Cedars-Sinai is the busiest cancer hospital in Los Angeles, we still have this small department feel with great collegiality.
The residency program is young and small. This program can, I think, uniquely, with a lot of fluidity, adapt to the ongoing needs of the collective residents and residents individually.
Our goal is to make sure that you can function as autonomously as possible. And so we make sure that we oversee what you're doing, but not overstep, to make sure that you can learn as much as you can on your own.
I was afforded this independence and the ability to just take off running from the get-go. And so I think that our attendings put a lot of trust in our residents. At the same time, also provide that same kind of guidance as well when we need it.
The faculty reflect kind of a breadth and range of training, diversity, and expertise. That expertise, I think, helps each of the residents learn that there's a variety of ways you can do things.
The culture of the entire institution is one that respects work-life balance. We want people to work hard in radiation oncology, but also have time to pursue things outside of radiation oncology.
The top 4 things that drew me to this program are the mentorship, the clinical training in terms of the breadth and depth of cases that we see here, the research opportunities, and lastly, the people and the location, I think, really sealed the deal for me.